us forward.
So I think we're here today to announce our partnership that we are moving forward with Uplink, and we're very excited about it. Quantum innovation for sustainable development goals. And so the partnership that we are forging at C4IR Saudi Arabia with the World Economic Forum's innovation platform, Uplink, is actually focused on leveraging its innovative challenge models tailored for both resource-rich and resource-constrained contexts. And so by collaborating, the center can actually pioneer transformative initiatives that are specifically on innovations for quantum towards SDGs in the Kingdom of Saudi Arabia, while also exploring cost-effective self-service models for the broader engagement and fostering a collaborative environment conducive to tackling global challenges. And this will further reinforce the Kingdom's pivotal role in catalyzing increased innovation and investment in quantum for SDGs. And so this partnership that we have with Uplink really aligns well with the center's mission and objectives of a recently launched project, which is focused on quantum economy. And our quantum economy project actually leverages the Forum's Quantum Economy Network Blueprint, a framework that was announced earlier in the year. And so for the project that we're working on, we will be working on developing a national strategic roadmap, and we will co-design this in conjunction with our multi-stakeholders, which include government, industry, academic and research organizations, and civil society. And so this will also lead us to a more effective and inclusive innovation ecosystem. In addition, it's expected to increase impact through targeted innovation challenges and projects by addressing key issues such as environmental sustainability, social equity, and economic development. And so through the implementation of innovative solutions, C4IR Saudi Arabia and Uplink can actually contribute to the achievement of the Sustainable Development Goals, helping to build a more equitable, resilient, and sustainable world.
That's brilliant. Thank you very much, Dr. Basma, and a warm welcome to the Uplink community. You know, it's a very tight family, and please, whoever is watching us, and also the startups and innovators who are working in this space, watch this space. It's going to be super exciting. Vivek, I would like to now transition to you, bring a different perspective. I always admire your vision for transformation of the mining industry. Again, I would like to refer to another stats from the International Energy Agency that has predicted to achieve the energy transition, the demand for minerals is going to double by 2040. And we know by the old way of doing things, we are not going to basically achieve that target.
Today's theme of redefining the global health agenda could not be more appropriate or more important. Firstly, we must ensure that sufficient financial resources are available to support health systems of developing countries, epidemics, infectious diseases, and the destruction of health infrastructures due to conflicts and natural disasters can erode the ability of the country's health system to provide even the most basic care. The global donor support base must be widened to include non-traditional donors, including more the private sector contributions and public donation campaigns. Improving the access and also affordability of developing countries to the latest innovations and technologies is also equally essential, and our healthcare training and also capacity building. When healthcare providers and also administrators have the knowledge and the skills they need to create and maintain robust medical sector, everyone will benefit. Ladies and gentlemen, the Kingdom of Saudi Arabia remains committed to the global health and also is a leading donor and also aid provider. Since 2015, KS Relief has implemented more than 1,125 very important health projects on behalf of the Kingdom of Saudi Arabia to more than 64 countries with a total budget exceeding $1.4 billion. KS Relief, on behalf of the Kingdom of Saudi Arabia, values its ongoing partnership with Bill and Melinda Gates Foundation as we work together to eradicate polio and strive to ensure that every child has the access to life-saving vaccine. We are pleased today to announce that the Kingdom of Saudi Arabia, represented by KS Relief, is signing a joint cooperation program with Bill and Melinda Gates Foundation in order to fight or to help in the global polio eradication initiative, and also the second round of the Life and Livelihood program managed by the Islamic Bank. This program will help more than 370 million people, mostly children and women. Let me pause here to thank the Kingdom of Saudi Arabia, Bill and Melinda Gates Foundation, and their co-partners. Saudi Arabia encourages every country to contribute by all possible means to strengthen the global health system. It is up to us, it is up to all of us to ensure that the future of humanity is healthy and hopeful to everybody. Thank you.
Dr. Al Rabeeah, thank you very much. And now can I invite the Minister of Health of Saudi Arabia, Fahid bin Abdul Rahman Al Jalajal, to address us.
Thank you, Your Excellency, Dr. Abdullah. Your Highnesses, Your Excellencies, distinguished guests. It is with a great honor and gratitude that I address you today. As we come in this close session for the insightful and thought-provoking session on bridging the global health gap, I would like to thank the esteemed panelists for the critical discussion on bridging the global health gap, which has shed light on the pressing challenges of global health. As we look ahead, the prospect of change brings excitement and, in the same time, brings concern when discussing global health challenges. The looming threat of climate-related health issues underscores the need for proactive measures to safeguard against future challenges. Based on past experiences, it is imperative that we coordinate our global response mechanism to mitigate the impact of pandemics and emergencies. National coordination is also vital in overcoming these challenges. In Saudi Arabia, we have established a platform for effective cross-sectorial collaboration by launching a Ministerial Committee for Health in All Policies. This committee brings together various sectors to collectively work toward enhancing the health of our nation by integrating health, equity, and sustainability into all decision-making processes. Ladies and gentlemen, our stride toward polio eradication signify not only progress, but also hope for the healthier future. Achieving a polio-free planet would be monumental success and a testament to global collaboration. In this context, Saudi Arabia's pivotal role in the region and globally shows the leadership in action to declaring the world free from polio. Ladies and gentlemen, humanity faces many other global public health threats, and antimicrobial resistance, AMR, stands out as a silent pandemic. Therefore, to bridge this gap and to address this critical issue, I would like to take this opportunity to extend the invitation to you all to attend the 4th high-level ministerial conference on AMR, which will take place on the 15th and 16th of November in Saudi Arabia. This conference will be titled From Declaration to Implementation, focusing on accelerating action. Let us all remain committed to creating a healthier, more resilient world for future generations. And remember, this investment toward health isn't just a good to have. It is a strategic imperative to thriving more resilient for futures together. On a final note, it is my pleasure, with great excitement, to announce our partnership with the Bill and Melinda Gates Foundation. We will shortly sign a memo of understanding between the Ministry of Health and the Foundation that signify strategic collaboration between both entities. Thank you.
Minister, thank you very much. And now it's my pleasure to introduce the co-chair of the Bill and Melinda Gates Foundation, Bill Gates.
Well, good morning, Your Excellencies, dear guests. In my life, I've been very lucky to participate in 2 major revolutions, relatively short periods of time when impossible dreams became global realities. The first was almost 50 years ago when Paul Allen and I started Microsoft. We had a dream that the computer would be a great tool for everyone. Many people thought that was impossible. After all, there were almost no personal computers in existence back in 1975. But we were determined to make it happen because we thought a world where everyone had that tool would be a fantastic innovation. And now we've achieved that. Computers not just on every desk, but in almost every pocket. But as amazing as that was, I'd say the second revolution to me is almost more amazing. It was 25 years ago when I was finishing my full-time career at Microsoft and starting my full-time career in philanthropy. In the year 2000, 9.9 million children died before reaching their 5th birthday. I remember learning that number and finding it hard to believe, especially because I had just become a new father. Why were millions of kids dying from preventable causes like diarrhea and pneumonia? In fact, vaccines existed for most of these deaths, and yet we weren't getting them out to the world's children. Back then, the idea of cutting child mortality in half in less than a generation seemed far-fetched. But it was done. By 2022, the number of kids who died before the age of 5 was down to 4.9 million. This is a result of a remarkable effort to improve vaccines, drugs, and other tools, and, most importantly, deliver them to the children who needed them all over the world. But of course, we all see this 4.9 million number as something we need to reduce further. So we have a remarkable human achievement, but still further to go. Of course, our goal should be to cut that number in half again, and I believe we can do it. In fact, I believe the potential to enhance children's well-being goes even beyond mere survival. We can get rid of this disease polio that historically paralyzed hundreds of thousands of children every year. Protecting children's health seldom stems from a single innovation. It typically requires the synergy of a number of tools and collective work. And we know when it comes to delivering better outcomes for children, eradicating polio is going to be critical, not only because it saves lives and prevents misery, but because it imagines a world where we can be free of all diseases, and it shows the power of partnership in coming together to make that happen. It was 1988 when the Global Polio Eradication Initiative started. Thanks to the hard work of partners like Rotary, health workers, and disease surveillance officers, wild polio cases have fallen by over 99%. Over 20 million kids have been spared being paralyzed by this virus. Today, wild polio is endemic, that is, has never been eliminated in just 2 countries, Pakistan and Afghanistan. I've had a chance to visit the operations centers in Islamabad and learn about the hundreds and thousands of workers who are working to protect children. Every day, polio workers and volunteers pour over data and perform outreach to communities to get the polio vaccine to every child. These workers are tireless, and because of them, only 2 cases of wild polio have been recorded in Pakistan and 2 in Afghanistan so far this year. The world is very close to eradicating one of the most preventable threats humanity has ever faced. But it's not done until we get to 0. It can spread back to where it was before. So we can't afford to slow down, or we'll risk unraveling decades of progress. We have the tools, we have the strategies, and now we need the partnerships and the vision. Fortunately, this is coming together. In fact, today is a totally critical day in making this happen. I want to thank the Kingdom of Saudi Arabia, His Royal Highness Mohammed bin Salman, His Excellencies Dr. Al Rabeeah, and His Excellency Al Jalalja for their generous contribution today. They are working with us to make this dream a reality. The new commitment will deliver vaccines, measles immunizations, and other health services to 370 million children. It's an investment in the future of children around the globe and in strengthening health systems. We saw over the last 4 years how important primary health care is. It was really these systems that allowed us to limit the spread of COVID. And these investments are paying dividends for many diseases. That's why it's so encouraging to see not only Saudi Arabia, but many other countries, including the United Arab Emirates, come together to increase their support for global health. The Lives and Livelihood Fund, managed by the Islamic Development Bank, is a fantastic example of this. It's a very well-run program that lifts people out of poverty across the more than 30 member countries of the bank. So it's inspiring to see the region, with leadership from the Kingdom of Saudi Arabia, at this pivotal moment addressing tough challenges. Throughout this forum, we've heard how global collaboration is the key. I look forward to our new partnership with the Kingdom of Saudi Arabia, collaborating not just to end polio, but to ensure a safe and healthy Hajj pilgrimage, to build new vaccine capacity, to better respond to urgent humanitarian crises, and fortify the world against future pandemics. We know that losing 4.9 million children each year is about a lot more than just a number. It's about millions of kids not reaching their full potential. It's also the ripple effect that better health for more people kicks off. Less poverty, improved education, and resilient economies. The stakes are very high, So I want to thank everyone who's stepping up to this historic opportunity. Thank you for building on the progress we've made, and thank you for your commitment to realizing a better future. Thank you.
Bill Gates and Dr. Al and His Excellency Dr. Al Rabeeah, thank you both. Thank you all very much. And now I want to invite the Prime Minister of Pakistan and the Director General of WHO and the President of Gender Equality at the Bill and Melinda Gates Foundation to come back to the stage for photographs. Thank you very much, everybody.